children through that would be both for children with developmental disabilities, such as autism, Down syndrome, cerebral palsy, as well as adults in the DDD system. So we are family members ourselves, and we host events for families. Our purpose is threefold. One, to provide information about services and supports out there for families, to gather input from families regarding their satisfaction with services and difficulties, and we help families navigate as well. And then we provide recommendations as stakeholders to the powers that be at the Department of Children and Families and the Division of Developmental Disabilities. We also have events like these to provide information to families, conference calls for chairs, statewide meetings that families are welcome to come to, as well as in-person events. We monthly at Wentz in Morris County, Parsippany, and if you've received information about this event, you should definitely sign up for our email blast. We let families know when we're hosting meetings. We also show families other meetings that are available to them. And our email address will be in the chat box. But it is Regional Family Support Planning Council, RFPC1 at gmail.com. So now, without further ado, I would like to introduce Kourtney Pulliam, Master of Public Health, the Program Manager for Family-Centered Care Services through the Division of Family Health Services. And point of fact, my boss's boss, because I am a case manager with Special Child Health Services in Morris County.
Thank you, Margaret. I appreciate that warm introduction. Good evening, everyone. I'm so happy that you all took the time out to join us this evening, especially as frigid and cold as it is this evening. So I hope you all are nicely warm and braving the elements outside as well. I was really excited to have this opportunity to share with you all. Hopefully, it's a reintroduction to Family Centered Care Services, in particular, two of our programs that focuses on for families with children with special health care needs. And so, with that, I'm going to go ahead and start the presentation. Just in advance, you all should get this in a PDF version. I did email them to Kyoko, as well as the brochure for two of the programs that I'm highlighting this evening, as well. Currently, we only have the English language version of the brochures available, but other languages are currently being developed, and I'll be sure to share that with this group so that you all have them in the future. Okay, and everyone can see my screen well?
Yes, perfect.
Yes. Perfect. Awesome. So going into the first slide, as Margaret mentioned, my name is Kourtney Pulliam. I'm the program manager over the Family Centered Care Services program in the Division of Family Health Services at the New Jersey Department of Health. So just a little bit about our division. Again, we sit within the Department of Health. Within our division, we have three programs. So there is the Maternal and Child Health Services, or MCH. That includes like your WIC program, um, Nurturing New Jersey, Connecting New Jersey, the doula program, the Community Health Workers program, a couple of other MCH programs. Then there's where my program sits within Special Child Health Services, and then we also have the Office of Women's Health is in the Division of Family Health Services. We're all on the same floor, so it's great. So in Special Child Health Services, we have four programs. We are led by Dr. Sandra Howe, who is our executive director, as well as our New Jersey Title V SHIN director. The Title V federal HRSA grant covers that maternal child health grant, and our director is over the children and youth with special health care needs. So within Special Child Health Services, we have a couple of programs. The first is the Early Identification and Monitoring Program. That encompasses the birth defects and autism registries. as well as the early hearing and detection programs and intervention led by Lena Naprovic. Then it's Family Center Care Services. I'll get into my programs. What's also in our unit is the newborn screening and genetic services. So that blood spot screening that all babies born in New Jersey gets, that little heel prick, that program is also located in Special Child Health Services. And on my floor, the team does the follow-up for any of those babies that do have any of those genetic screenings positives and does the follow-up immediately with the families and physicians. And then the last program that comprises children with special child health services includes our data systems and emerging threats. So we have several CDC grants for emerging threats to mothers and infants and do a lot of data coordination. So during we did the follow-up for those pregnant persons with Zika during COVID, all of those pregnant persons, and follow up with them, as well as some of the emerging threats such as congenital syphilis, CCMV, just to name a few. So we're a busy unit. So just as I mentioned, these are all of the programs that comprise special child health services. As I mentioned, there is, and I'll get into mine, the case manager programs, but as I mentioned, the birth defects registry. So all of those children 0 to 5 who have congenital disabilities that are registered. Then we have our specialized pediatric services, which I'll talk a little bit more about. Our early hearing and detection services. So also in the birthing hospitals when the baby has a hearing test. If there's any follow-up that's needed for any failed screenings, we are in that program is in my unit, as well as the autism registry, newborn screening. What hasn't been mentioned is also the Ryan White Part D program, which is our HIV program for women, infants, children, and youth who are infected with HIV or AIDS, as well as the sickle cell data collection. So following those individuals in New Jersey who have sickle cell disease. So I will primarily talk about my programs, which is covered under Family Center Care Services. So the 4 programs that I'm responsible for are the Special Child Health Services Case Management Program, which Margaret mentioned that she is a wonderful case manager over, the Specialized Pediatric Services Program, the Ryan White Part D program, and the Sickle Cell Data Collection Program. I'm going to focus primarily on the case management and specialized pediatric services program, but I can answer any questions if you do have them about the HIV or the sickle cell data collection program. So who is Special Child Health Services? So we are a no-cost referral resources to New Jersey children with special health care needs. We call them SHIN, which is the federal abbreviation for the population, and we cover all children from birth to age 22 and their families. So SHIN are identified as children with any increased chronic physical, developmental, behavioral, or emotional conditions. So this is inclusive of those that are congenital or that are from utero or things that are developed later on in adolescence through screening processes. So, from all of those physical chronic conditions to those that are developed through developmental pediatricians, such as ADHD, autism, any other behavioral diagnoses, emotional conditions, and intellectual conditions. So covering the whole IDD population for those young adults, youth, and children. So special child health service case managers with parental consent work with the children's parents, physicians, and other specialists to evaluate a child's strengths and weaknesses. And we have case managers located in all 21 counties in New Jersey. So who's eligible? The eligibility requirements are very few for our program. So for case management, any child living in New Jersey, as long as you are between the ages of birth and before your 22nd birthday, you're able to access our case management program. Citizenships is not required, and there's no income requirement and no cost. So we're one of the few programs that aren't income restricted or having to meet a cap or a federal poverty line minimum. We service all children in New Jersey with special health care needs, as long as you live in New Jersey. You don't have to be born in New Jersey, but live in New Jersey. So, who's eligible? So, like I mentioned, those are those long-term medical conditions, autism, hearing and vision loss, physical disabilities, birth defects, ADHD, developmental delays or disabilities, traumatic brain injuries. These are just to name a few. But we can help a MRID in any combination or any single one of these conditions are would meet the eligibility requirement to receive case management services. So referrals, how do we get the children? So there's a couple of ways that children are referred to the case management program. Um, Automatic referrals, as long as you are a listed, registered in one of the registries listed, so either the birth defects registry or autism registry, if you are a named registrant, you will receive a letter notifying you that you are eligible for case management services, as well as we get referrals directly from parents. So you may see Margaret, or I see some of the other case managers that are on this evening at a tabling event informing you about the program. You can self-refer yourself into the program, which is absolutely fine. Oftentimes, too, some physicians may refer families to our program as well. Um, and other programs that do oftentimes refer families to us are those in early intervention services. So that NJEIS program, typically when children age out, like closer to their third birthday, they're should be informed of our case management programs. If not, you're eligible. And if you never heard of us, you can refer to us at any given point as long as your child is under the age of 22. So this is just a visual of the referral process into case management. So as I mentioned, self-referrals, the birth defects and autism registry, community agencies that we have partnerships who know of our program can refer families to us. You have your PCP and specialists who will refer to us. And then what you get from us is a myriad of services and support to help you along the each developmental stage and milestone for your child. And I'll get into those. And so, who are our case managers? So, our case managers are comprised of registered nurses and licensed social workers. So, each county's makeup is a little bit different, but the requirement for all of our case managers are those who have either a licensed social worker or nursing background. We've also expanded to others who have worked with children with special health care needs in a specific capacity. There are some who have like special licenses and certifications for working with children with special healthcare needs. So that's an additional qualification that's an additional qualification to meeting the program eligibility. Um, So who are our case managers, or what do our case managers do? So our case managers make referrals to assist and support families access state, federal, and other local community-based resources. So this can include assisting with NJ Family Care, engaging with early intervention services if they're still eligible for it, Social Security, any local charitable organizations, just the New Jersey Children's Care System, as well as they collaborate with other family and faith-based partners to develop individual service plans for each child, so that goes across the age spectrum of all children, and also help them assist with transitioning into adulthood. So that transition from pediatric care to adult care is very different. And we do help those families navigate that process starting as early as 12, especially as they age up and out of high school and into adulthood. So, what I have here is the individual service plan, or what we call an ISP. So, each child that's enrolled into the case management program has an ISP, and this is developed with the parent, the child, and the case manager at each respective county that helps identifies the areas that may need additional support, or what's covered, or things that they should be considering as the child ages up. So in an ISP, the kind of domains that are covered are healthcare. So making sure within the healthcare system for their child, they have all of the PCP or specialists that are needed to help assist their child's condition, whatever it may need, especially dental. Dental is very important for the special child health, special child population. We know how difficult that is. It's difficult for those neurotypical individuals, but especially dentists and making sure they're on track with that. As I mentioned, the transition to adulthood. When entering and transitioning into adult care services, our case managers will help identify adult health care insurance, primary care providers if that changes. They assist the family identifying and vocational services for their child if they are eligible, any continuing education if they do choose to continue in education that whatever either IEP or any other learning accommodations that are made at in those other settings that they have those too. They also link those children as they age into adulthood to adult community-based agencies and services, or even just help the family plan from thinking about either shared decision making, guardianship, trust, because we know oftentimes we think of the now and not kind of planning in for the future for the parents, and what that switch is like going from um, kind of pediatric adolescent services into adult and looking what those DDD accommodations can be for their child as they become an adult as well. Um, Education, while the child is under 20 from 3 to 21 in the academic setting, making sure that any child study team or any IEP that's in place, that it is reflective of what is needed for the child in that learning environment. If they need additional support services or advocating when it comes to the child study team and getting those accommodations met for their child, our case managers will assist them in that. Um, for rehabilitative equipment technologies, making sure they're connected to OT, PT, and any other technologies that might be needed. Feeding tubes as well, specialized formulas, making sure all of that is accommodative. That is something that is needed for their child. For family support, looking at insurances, food stamp, what other programs or things they may be eligible for, and also provide some of those other local and state resources when navigating different things, especially if they qualify for any um, utility or housing or electricity accommodations as well. And then for the emotional and behavioral health, the children's care system, perform care and things of that sort, making sure the families are linked to them. So our kind of statewide partnerships that we do have that all of our case managers and case management units have access to are the Autism New Jersey organization. So we have a longstanding relationship with them, especially for those individuals with autism, with linking to the system support services as well. We have a great working relationship with SPANS, Parents Advocacy Network. They are a big helping hand for families when navigating that child study team and EIP and other accommodations in that school setting. And then lastly, with the New Jersey Catastrophic Relief Fund. So we know that oftentimes with our children with special health care needs, there could be extreme financial burden with the care and treatment, and the Catastrophic Relief Fund is an available fund that families can access even past their child's 22nd birthday with accommodating or getting some financial relief for medical expenses that exceed 10% of the family's income or 15% of their income over $100,000. So that is a really great resource that our case managers often navigate with families, especially if there's any um, services that they pay out of pocket that exceed or that kind of put that financial burden if they have to do any modifications to their home or vehicles as well. That is something catastrophic relief funds have been able to alleviate as well. And our case managers are well equipped to assist with them in the catastrophic relief fund application. And lastly, for case management, one of our special projects, pilot projects that we're currently doing is the emerging challenging behavior. And we're targeting children with profound autism, ages 4 to 7, who are exhibiting challenging or disruptive behaviors. And what we're intended to do, and is in collaboration with Autism New Jersey, is to provide more of a parent resource, tools, and support with how to um, prevent those disruptive behaviors, whether it's um, either engaging in new techniques when having those outbursts, if it's helping them better navigate some of the systems that their child is accessing, but they're feeling more equipped so that early intervention with this pilot program is preventing future more violent or harmful episodes as they age into adolescence. And here, and as I mentioned, I did share that you will get the actual full digital brochure. It's just a snapshot of our special child health case management brochure. And you'll see each county has a respective case management unit number listed and just goes over again what we do, who we serve throughout the state. The second program, as I mentioned, I wanted to discuss is the Specialized Pediatric Services Program. So case management is, I like to say, is the non-medical side of the support services, and then specialized pediatrics are the actual physicians that are seeing the children with special healthcare needs. And so we fund several agencies, 18 total, to cover the Specialized Pediatric Services Program. So our specialized pediatric services programs are divided, the agencies are divided into three groups. Some are child evaluation centers, what we call CECs. Some are cleft lip, cleft palate, craniofacial centers, and then some of our pediatric care services centers. So for our child evaluation centers, these are our centers that assess, diagnose, and treat children with or at risk for developmental behavior. And this is a multidisciplinary team that does a multidisciplinary evaluations of children with cognitive or acquired neurodevelopment or behavior disorders. We have four centers or CEC centers of our eight child evaluation centers who are also fetal alcohol syndrome disorder centers that provide comprehensive evaluations for children from birth through adolescence with confirmed or suspected fetal alcohol syndrome. And then also the actual medical team at the child evaluation centers have medical ISPs for each of the individual children that they see. So some of the diagnoses served at our CECs are listed here. So this is where we have those providers who do and confirm those autism diagnoses, as well as ADHD, speech delay disorder, um, hearing, auditory, so those follow up with any hearing or visual impairment issues, behavioral disorders, developmental delay disorders, intellectual disabilities, learning disabilities, psychiatric disorders, and other neurological impairments are as well covered under our CECs. And so our CECs are located throughout the state, covering the whole entire state. So we have a location that is at Mays Landing and Voorhees through um, Children Children Specialized Hospital, which you'll see over there on my next slide, as well as CHOP. Cooper, University Hospital, Jersey Shore, University Medical Center, JFK Medical Center, Morristown Medical Center, Rutgers, and St. Joe's. And because we fund children specialized, that means that we have access to all of those children specialized locations, as you'll see on this slide, and what they also offer at their individual clinics. So fetal alcohol spectrum disorder program. So as I mentioned, four of our CECs are also co-funded to support the FASD program and evaluate for any suspected or confirmed FASD diagnoses. And they serve as a regional training and education center for early detection and treatment for FASD. Um, and they also collaborate with the perinatal addition programs to ensure the availability of resources to providers. So our four CECs that are also co-funded to do FASD include our CHOP locations at Mays Landing and Voorhees, our Children Specialized in Union, the Rutgers, New Jersey Medical School in Newark, and then also our Jersey Shore Medical Center. So shifting into our cleft lip, cleft palate palate centers and craniofacial centers. They are our state-of-the-art comprehensive assessment and diagnosis treatment services for New Jersey residents with cleft lip, cleft palate, craniofacial anomalies that covers children from birth to 21. So this is a comprehensive team approach. So the teams typically consist of like plastic surgeons, speech pathologists, and other specialists on the multidisciplinary team and see the families from pre-surgery and post-surgery and follow-up. So as I mentioned, this is usually what the team consists of for each case. So plastic surgeon, orthodontist, dentistry, speech, audiology are listed here. And our five centers that provide the service are St. Joe's Hospital in Patterson, Cooperman Barnabas Health, St. Peter's University Hospital, New Brunswick, Monmouth Medical Center, and our Cooper University Hospital in Morristown, New Jersey. So again, covering from north to south Jersey. And lastly is our pediatric tertiary care center. So these centers are our comprehensive interdisciplinary assessment, diagnosis, and treatment centers for children with subspecialties in pediatrics in an outpatient basis. So oftentimes the specialists seen here include cardiology, neurology, gastro, ophthalmology, genetics, psychiatry, occupational therapy, and speech pathology. And our three tertiary care centers include Cooper University Hospital, Children's Hospital at Newark Beth, as well as Robert Wood Johnson Medical School in New Brunswick. And again, my information here, if you have any general questions or want to be linked to any one of the services or programs that I mentioned here, we do have a hotline that we check daily, a voicemail that we check daily that's listed at the number below, as well as an email address too that we check daily. And then also there is my personal contact information if you want to reach out to me to get connected to any one of the services from the case management program to the Specialized Pediatric Services Program, or even any of the Ryan White or sickle cell disease program as well. And thank you. And let me see if there's any questions. And thank you, Kyoko, for sharing that information.
Thank you, Kourtney. There's one question. Is there a 800 number for SEL referral, or do families go directly to the county office? And what's the time frame for return callback?
So you could do either or. So my hotline, if you leave a voicemail within 24 hours, we'll follow up and link you to your respective case management unit, or you could call them as well. And I think typically each case management unit replies back within 24 to 48 hours with that. Similarly with emails, 24 hours or less, depending on when it comes. Of course, if it's on a holiday weekend, you may have to wait a little bit longer, but the response rate is relatively quick.
Thank you. That's the only question we have received in Q&A section, but maybe I can stop the focus mode so that and someone raised their hand. So let me stop focus mode. And that means anyone who'd like to speak, we will call you. So please raise your hand and we will call your name and you can unmute yourself and start speaking. So Beatrice. Oh, hold on. Let me see. Okay, you should be able to unmute yourself now.
Okay. Yeah. All right. Thanks for the presentation. I was multitasking, so pardon me if I may have missed parts of the presentation. So when it comes to children with autism, you said that you contracted through CSOC to provide those services, or is it through other autism providers in the community? I'm asking this because I'm a parent and also a community provider. And what I'm seeing is that most of the families with children with autism don't really get ABA services in the home. They want them to go through their insurance, and whereby if they have self-pay insurance, like private insurance, their deductibles are so high that most of them end up not, going through the services for their loved ones. So this is just to for me to understand how to advocate for my own self and also for the families that I serve on the other side. Thank you.
No, thank you for your question. So, those services can be provided or assisted and navigated with our case managers. We know and aware of those those limitations that some of families may face with one, the out-of-pocket expense, as well as sometimes having to meet those minimum requirement hours to get those in home. And so what we try to do is kind of get a catalog of available ABA therapies that families can access that is within the respective region. And so working with the case managers for each county, they respectively have their lists that and are aware of those kind of requirements across those various agencies that work within their service areas. And oftentimes when I get the inquiries, so I oftentimes get kind of the companies to email me directly saying, hey, list me as a resource. The first question I ask is, what insurances do you take? Do you take Medicaid? Do you take all New Jersey Medicaid? Do you take private? Do you have a minimum requirement? So I ask those questions because that is the frequent barrier a lot of families are facing. And so what we're trying to do is throughout the state is have a catalog of those therapies, and then also our case management units specifically know the ins and outs of those various organizations and agencies that families would be eligible for. So we don't solely go through CSOC, but we have other outside agencies that we work and collaborate with, knowing the different um, requirements that some of those ABA agencies do have.
Okay. Is it okay if I email you if you can send me those catalog,
Sure,
or
yeah,
is
we're in
it
the process of developing it, but you can
okay?
definitely let me know which families um, you primarily work with, and I can link you to that case manager's list.
All right. Thank you.
Mhm.
So I can just add, it's Margaret, that, it's always good to contact your insurance company and request a care manager, which is a free service that someone that's usually a nurse that knows the ins and outs of things medical, but then also knows who's in network with your insurance. And then we have lists of all the New Jersey Family Care, separately, who takes Horizon NJ Health, who takes Aetna, and then we have a lot of local lists as well. And the deductibles are difficult because you have to get past them. And I don't know, but income sometimes, even though there are caps, catastrophic might be able to help with some of that,
Mhm.
unreimbursed expenses that you have.
And yeah, that's to Margaret's point too. That is where catastrophic relief does come into play for a lot of our families because of those in-home treatments that families do want. That is that out-of-pocket expense oftentimes does meet the requirement to get that financial assistance as well because it is a part of the care for the child.
Hi, Courtney. Great to see you, and
You too,
thank you for
Mercedes.
being here. One of the things that we hear often from families, all ages, and particularly younger folks as well, is oral health and dentistry, and in particular, dentistry with sedation. Are there resources that are generally available in all the counties, or and how are connections made when folks struggle to find adequate oral health or dental services?
So that's a great question, and we're intentionally collaborating with the New Jersey Department of Health's dental program to help identify and share those resources. So currently, the dental program for the state does sit within the Division of Health Promotions, and they have a list of dentists who do service children with special healthcare needs who provide sedation or not. They have a new tool that identifies those providers throughout the state that do that. In addition, where this program, children specialize, sits, or not children specialize, special child health services under the Title V grant, we also are making sure we're identifying those resources. That our case managers are also able to share with families. So there are some now, especially in the South region, which was kind of is real challenging for some of those families in the southern region of the state with getting some of those dental services. Now there is a agency that's in Philadelphia that accepts New Jersey Medicaid that provides the sedation and other special accommodations for children with special health care needs. And we have those others that are in the central and north region as well. And the insurances and things of that sort. So I can definitely share with you all the dental resource, but we are intentionally collaborating with the state dental program. They do have a dentist and a dental assistant now funded through that program that are working regularly with us and special child health services to make sure that that need is also identified. I believe they also are developing a tool that even shows the transportation route to make it easier and more accessible for families to knowing that not everyone has a vehicle or can access a vehicle to get to some of these places since it is can be far or further away from where they actually live or the county they live in.
That's awesome. Thank you.
You're welcome.
So next is Annalise, and after her, we have 3 questions in the Q&A. So Annalise, it's your turn.
Thank you. Thanks for the presentation. My question is, my daughter is 2.5 and has physical and developmental disabilities. Do I wait for a referral from early intervention as she ages out, or is self-referral acceptable if I wanted to join this program?
Because she's 2.5, you are to our program directly to go ahead and begin those services, to get connected to your respective case manager and start that with your in preparation for your child aging out of EI services. So typically for those who are currently in EI services at 2.5, you can begin working with our case managers. But even during, you can still tap in and chat with our case managers until then. But at 2.5, we can start working with you.
Okay, great. Thank you so much.
You're welcome.
And I just dropped the case manager directory in the chat box, and it covers whole state of New Jersey. So if you live outside of #1 catching area, which is Morris, Warren, and Sussex, you can find anyone throughout the state. So Kourtney, we have 3 questions in the Q&A box, so I will read it each one of them. Are there programs primary for children over 3, with the exception of the specialized pediatric services programs?
Primary meaning like primary care services.
Primarily, I think the question is, your whole unit is for children over 3 years old.
Oh no, we cover so the specialized pediatric services are from birth to age 22. So as far as the actual medical assistance, that's from birth, so there is no age requirement there. You're considered only peds up until age 22. And then the other services they do are all birth. So like the registries are from birth. The case management services are we can cover the children at birth if they're not in EI services. If they are accessing EI services, we just can't work with the families directly until they're 2.5.
Thank you, Kourtney. And the next question is for the Emerging Challenging Behaviors Program. Does that come to you or through the county? And can it also be self-referral? And can a school refer with family permission?
So that is identified through the case managers to work with our special ECB manager for that pilot. So we have our case managers in our respective counties kind of flag those families who are interested with those services, and then our ECB manager, which is our Emerging Challenging Behaviors manager, works directly with them to follow up with that. Currently, it's a pilot, so the schools aren't necessarily notified, but for it. However, our families currently in, or now you all who now um, may enroll with our families can share that from hearing about the pilot. That is something that you're interested in for your child.
So
And
would
we
you,
are, sorry, go ahead.
I'm sorry, so would you recommend families to reach out to their county case managers to ask for referral or at least have a conversation?
Yes, you can either reach out to them, or for any reason you can reach out to me to directly, and I can um, connect you to the case manager, and also we can make it aware of our ECB manager as well.
Thank you. And I will read the last question in the Q&A, and then Kwanisha, you're going to be next. For a family to access the special child health services for their loved one with a neurodevelopmental condition, such as autism, am I understanding correctly that an individual needs to be registered with the Autism Registry first through New Jersey?
No, you don't have to be registered first. What happens typically is that for families who may be waiting for the diagnoses or to complete the registration, they can go ahead and start working with our families already. They just kind of note that with our case managers. Our case managers have access to the birth defects and autism registry, so they can see when it is available. So what that essentially shows in our system is that you are awaiting that diagnosis, and there's something that happens on the back end to connect kind of the files together. But you do not have to have that diagnosis when you access our services. You can share how you're suspecting or awaiting a diagnosis, or you could be on the waiting list to get a confirmatory diagnoses as well.
Excellent. Thank you. And Kwanisha.
Hi, thank you for the presentation. And my question, it was pertaining to the autism registry, and as far as case management. I am located in the Passaic County area, and my son was diagnosed with autism in May of 2025. And I was told from the physician that he would be included in the autism registry, but I hadn't heard anything back. I did reach out to the autism registry a month ago, but I still have not heard anything back. And how would I find out if this registry went through? And shouldn't my son or I be involved with the case manager within our county? Because he also has a physical disability as well.
And then also, yes and yes. So you can reach out to myself,
Okay.
and I can I'd be happy to look to see what goes on or what happened with that as well. And we can link you to the Passaic County Case Management Unit with that. Sometimes because the registries come in batches, I believe it's weekly batches,
Mhm.
that they process them, as far as there could be some delay with that. However, if you have a diagnosis, you don't have to wait for the letter. Now that you know that you are eligible for those services, you should have them. If your son had that birth defects or that physical condition, it depends on if that physician registered it in our birth defects registry, if you would have
Mm.
gotten access to us earlier or not, because there are certain conditions that are um, listed on the birth defects registry that will qualify for a physician to register it. And hopefully that facility is up to par and doing what they're supposed to do. We're finding out when they're not. We do a nice gentle reminder reminding them about our birth defects registry and our autism registries and making
Yes.
sure those diagnoses are completed so that we can support those families. But just know you can reach out to us at any point, and we'll be happy to do that. So I think again, I shared
Okay.
my information and I'd be happy to follow up. We just make sure that we're talking to you and not someone pretending to be you.
Right.
So there is a confirmatory process because we just don't want to share anyone's information. But once we get that, then we can link you to those services and be happy to assist you and your son.
Perfect. Thank you so much. Thank you.
And we received kind of related question about autism registry. So this person's child is 12 years old and has diagnosis of autism spectrum disorder at age 6 by a developmental pediatrician. And he also has ADHD, auditory processing disorder, and dyslexia, dysgraphia. He's high functioning, but his disabilities do affect his quality of life and will need additional services as he transitions into an adult. Who can assist me with getting him on the autism registry? How long does it take? And she also would like to have a case manager.
So you can reach out to your case manager, or you can reach out to me and I can connect you with your case manager to assist to make sure that that diagnosis is confirmed. So we do that oftentimes, depending, again, some providers are better with registering their children than others in the state. And again, we're only responsible for those providers in New Jersey for doing the diagnosis. So if you are having a physician who does a diagnosis that is outer state, not all of them are aware of, one, we don't put the mandate of the requirement on outer states. Now, some of the physicians like the that are out of the CHOP centers or those that have networks within the state of New Jersey, they are aware of the registry, but some of those other ones, if the diagnosis happened out of state, they aren't registering in New Jersey when they're here. And also too, if you are coming into New Jersey with already a confirmed diagnosis, there is no like re-diagnoses that happens. So that could be, I don't know if that is a situation that happened for this particular parent. However, I say all that to say we are more than happy to link you to your case manager to make sure, one, that you are in the registry for New Jersey and that you get the support services that you need for your child.
Thank you, Kourtney. And another question is, so this person, I believe parent, lives in Warren County, but her daughter was born in Pennsylvania.
Mhm.
Do they give the information to the state of New Jersey if that was where our residence is?
It depends on the birthing hospital in Pennsylvania. Yes and no. If you were a resident of New Jersey at the time that you delivered, then it should, but that's not necessarily the case. And so if you did have a birth defect, or if your child has birth defects or an autism diagnosis, and you never received information about any of my programs that I mentioned or any of the programs in Special Child Health Services, you can reach out to myself and I'll be happy to link you to make sure that you are in the registry and then also you get access to the services that you need.
Thank you. And that's, you have answered all the questions in Q&A sections.
Great.
So everyone, if you have any additional questions, you can just raise your hand, or if you, more comfortable typing in, you can do that too. And maybe meanwhile, maybe, Kourtney, I would like you to kind of, reiterate, the parents usually do not have to go through rigid or kind of high intensive referral process, because I think that's very unique for your unit. I know several parents even feel discouraged to even start the process because they anticipate, I have to do this, do that, I have to prove this, prove that. But I heard that your unit has a different approach. So would you like to elaborate that?
Yeah, so just accessing our service, we try to make it as low burden on the families as possible. Oftentimes, we just want to make sure we confirm we're talking to who we're talking to. We don't want anyone impersonating the parent or the guardian of a child, just because this is sensitive information. Because um, in this current climate, this is my only political statement that I'll make. In this current climate, we're very sensitive about the information that is shared of the children in New Jersey. One. And then two, we respect those families who choose to either remain anonymous and access our service or be named and access our service, but that all of that information is held confidential and legally within our unit. So there is no data sharing as far as that information. I know that was a big concern with the change of administration, the executive orders that came out, and all the various talks that have been in the news about information regarding health information and whether you access or don't access services. So when accessing any of the programs that I mentioned, the only requirement is that you identify yourself and your child's information, and we confirm or not confirm if we do have it. And then we go from there. And if you need to get registered in any one of our registries, we're happy to assist. And that process is um, I say pretty low stress with that.
And I'm pretty sure, parents are truly appreciate that. Beatrice, like, did I see your hand up?
Yes, my hand came up and I thought about the question, but I don't think it's a question that pertains to this department, but I'm gonna ask anyway. Does this division helps pay for college if my ward is planning on going to college? Beside FAFSA and other stuff, are there any incentives, anything that we can tap into, or this
So
doesn't fall under?
So that does not fall underneath us,
Okay.
unfortunately. That's more probably the Department of Education um, requirements now as far as any other accommodations as children go into higher education or continue education. Some of those things are covered, whether it's through the Division of Human Services or the Department of Education as well. But that is none of those costs are covered underneath any of these programs in this division.
All right, thank you.
Thank you. Mercedes.
So I'm just going to share a personal testimony to the Office of Special Child Health Services. Um, not every disability or reason for accessing your services on your list begins at birth. And when my daughter was 16, she had a major medical event that since has she's remained with a number of disabilities. And it was a call from Special Child Health Services, which I think is like this hidden gem of a service. I was almost hesitant to speak with the social worker because I just had never heard of it and um, wasn't sure if it was, a scam or, somebody was calling me that to just get information that wasn't appropriate. So, but once I recognized that this was a resource, it was, it was like a gift. So that was many years ago, and I know Margaret and other folks who just do an amazing job. So, um, I think it's those hidden treasures, those hidden gems out there that sometimes we either don't know or we're a little bit hesitant to know about. So I just wanted to share that as just a personal testimony to, the great resources and knowledgeable people that sit on the other phone, many of whom, either have lived experience or enough experience that really gets good information in the hands of families. So just my personal testimony to the service. So thank you. Thank you all for the work that you do.
Thank you for that, Mercedes. I think too, depending on when you get the letter, sometimes too, depending on what your child may be facing, it could be a very challenging time and you may just put it to the side and forget it. And just know at any given point, you could go back and like you never are ineligible for the services outside of when you age out, but you can access us at any given point. So like you said, like especially if your child has, if you are born with a condition or you just got the diagnoses or you just left the office and you get this letter from the Department of Health, you're just like, what? I'm freaking out. Like, why? How do you know who I am? How did you know all of this information? And it can be alarming, but just know like we're here whenever you are ready. And so if you've maybe seen or came across a letter at one point and you're like, oh, maybe it's too late. It's never too late. You can always reach out and find out. We can find out where you're at and where can we help fill in the gaps for you. And so that's kind of what we're here for. And then, as Mercedes mentioned, our case managers are very, very well versed. Even the staff here at the state have that lived experience. We know what you're experiencing. We understand the challenges that you face, and it could be a lot. At any given point, we just want to make sure that you have the support that you need as you're navigating this, not only for yourself, but for your child too.
And I also would like to echo what Mercedes said, that I have spoken a couple of people who are really appreciative of your services, and they said that, when I need like a little bit of extra support, you give it to them, and then if everything is going great and you guys kind of leave them alone. But they also told me that they really appreciate it. Like once a year at least someone would call me, or like twice a year someone would just call me, just checking how are you doing? How is everything going? And your staff has such a great longevity, and having that connection in the community. I heard that many people truly appreciate that.
Right. I'm just happy to do that. I'm calling any opportunity like this to speak to some of these advisory groups and family groups just to do the reintroduction because you all have probably interacted with our program in some capacity at some point, but it's that hidden gem, and the more visible the program is, I think the more services and support families can feel like to know that they're not alone. Our case manager, I'm very fortunate to work with Margaret and her peers across the state that I'm just able to elevate and put forward all the great work that they do. So I'm happy to do it. It makes my job easier too.
I have to say that one of the challenges that I have is when I do have to close a case and somebody says, well, who takes over after you? And, it's not a lot. Oftentimes if they're in the developmental disability system, they get a support coordinator that helps them spend their budget and things like that. But yeah, it's a great program. I'm with families for years and years.
So with that, I think we have answered any questions, and I'm pretty sure that Kourtney and Margaret would be happy to answer any question you may have. Sometimes a question pops up after the meeting. So please do not hesitate to reach us if you have any questions. And I will send the presentation slides and the brochures Kourtney has shared with us probably tomorrow. But Margaret, do you have any closing remarks?
I think we were just going to do a little bit of council business, if that's okay. We just have a couple of announcements and, like I said, with the council, we work with the Family Advisory Committee with DDD and the Division of Children and Families. So, if people have to go, that's fine. Kourtney doesn't have to stick around, but we just like to do that for a couple of minutes and maybe answer any questions people might have about the council.
Well, thank you all for having me. And again, thank you, Kyoko, for sharing my information. I'm here. Margaret, if you have any questions too, or get anything that you need me to follow up on, just reach out. Happy to. Have a good
Will
evening,
do.
everyone.
Thanks so much.
Thank you.